Hi, everyone. Delighted to be here and excited to share with you some of the latest work that I have growing out of this concept that I'm developing called cautious citizenship. And I'll jump in just a moment to what I mean by cautious citizenship with a working definition. But I want to start by sharing with you a story and a set of stories that help capture what I mean about immigration enforcement in particular having this connection to health politics that is deterrent, it's deteriorative, and it's deleterious to health. This image is from the spring of 2014, just a couple weeks before the deadline for enrollment in the Affordable Care Act. And what you see are representatives from Univision and Telemundo, the two largest Spanish language news media networks in the country. On the left-hand side is Enrique Acevedo. In the middle is José Díaz-Balart from Univision. And then there is, of course, then President Barack Obama. And he was visiting this special session that combined the two studios of Univision and Telemundo to send a message to Latinos. In the background, you can see the Capitol, and then there's also some symbols that let you know that there's a discussion about health taking place, and he's specifically encouraging Latinos who at the time represented 1 in 4 of the uninsured in America to enroll through the exchanges. And so he was pleading and asking these well-known, household name media representatives to pass on the word to their audience that they were encouraging Latinos to get enrolled in the ACA. And about halfway in the interview, both Enrique and José Díaz-Balart, Enrique Acevedo and José say, but Mr. President, many Latinos are nervous about enrolling. And at that moment, they shifted into a short video where they brought in, through teleconference, a woman standing with her daughter. And she was asking a very simple question about the process of enrolling online and wanting to know specifically about how the information that was being collected on the healthcare.gov website was going to be used, how it was going to be managed, and specifically whether it was going to be turned over to immigration authorities. And his response was, don't be afraid. I assure you that none of the information that is being collected will be used for enforcing immigration laws, so you don't have any worry whatsoever. And this, right, was in the face of recent massive investments in immigration enforcement operations. From 2000 to 2016, under about half of those years under President Obama's watch, funding for immigration enforcement increased from $7 billion to $19 billion. And it also shifted in terms of the focus going from ports of entry, but also towards the interior. And I'm showing this graph on the left-hand side that stops at 2014, but gives you a taste of the ramped up deportations that have been occurring over the last 40 years. And so it was for good reason, right? It was for good reason that this woman was concerned about immigration enforcement and sharing of her information and wanting to know what was going to happen. And boy, a lot can change from one administration to the next, right? Shortly after the eve of his election, now President Trump stated, we are getting them out of our country or we are going to incarcerate. And this was, of course, referring specifically to his plans and thoughts about immigration enforcement. This was from November 13, 2016 on 60 Minutes. So he has made he hasn't hidden at all what his policy preferences and plans are in terms of immigration enforcement. He, in fact, increased on top of that shift from 7 to 19 billion. He's increased funding for Customs and Border Patrol by 22%. That, by the way, does not represent what he initially wanted. He wanted lots more to go into these operations. He wanted specifically to hire an additional 5,000 new agents for at ports of entry, and then another 2 on top of that to do immigration and customs enforcement operations. during the short time that he's been in office, immigration arrests have increased by 30%. We don't have numbers just yet for 2018. But he also expanded the operation and the expectations and the notion of immigration enforcement in some other key ways. Some of these, of course, you'll recall from the campaign trail, but also immediately after he entered the White House. There was, of course, the Muslim ban, the response to refugees who are legally seeking asylum at ports of entry with a military. I think he just approved recently, or yesterday or the day before, 5,000 members of the military to meet the latest caravan of refugees from Central America. He has also began a systematic targeting of non-citizens, including legal permanent residents, who, up until this point, could safely think of themselves in many ways as pretty much US citizens. So sure, there was a couple of things that they couldn't do, like they can't vote, but there were lots of provisions, even with the 1996 Welfare Reform Act, that allowed for legal permanent residents to take part and use social services. With the introduction of the new sort of element of the public charge debate and reintroducing that rhetoric into the discourse, there's a question about that. And then, of course, the proposals have been floated for some time now and getting more and more attention about ending birthright citizenship. And then the most sort of heartbreaking recently from this summer were the images and the continued separation of families at the US-Mexico border. Yeah.
When they're targeting legal permanent residents, on what basis are they saying that they don't have a right to be here if they're legal permanent residents?
Well, it's related to that second, the next bullet point about public charge is one. But I think it is basically the idea that we need to monitor and understand carefully who is in fact used their time here in the United States in a way that meets this really high standard of conduct. If your intention is to become a citizen, then we need to know what have you been up to. And there have been, in fact, news this summer and early fall of legal permanent residents who have been detained and are being processed for deportation now as I speak. So this is happening. That's on the more sort of egregious side, but it's definitely opening up and establishing a precedent, right, for continued monitoring of legal permanent residents. All these shifts in terms of the investment in immigration enforcement, the expansion in immigration enforcement targets, and widening the scope in terms of what is going to be important for federal authorities to focus on, right, brings me to this question about the consequences of immigration politics. And so I'm asking specifically in this slice of research that I want to share with you today, how this is spilling over to healthcare matters. And I want to know the extent to which this is spilling over into three areas. One is the access and use of resources. Another is the extent to which this is influencing how people view the government and officials, so attitudinal formation. And then I'm trying to connect what we know in public health to theories in political science by asking this third question about whether this is harming people. So I'm going to give us a slice of evidence that addresses each of these themes. And the summary of the findings that we're going to walk through today demonstrate that in these first cuts of analyses, we've got evidence that shows immigration enforcement deters access and use, it deteriorates trust, and that it is deleterious to health. So I want to share with you bits from stuff that I've done that's in print now and some stuff that's a little fresh, a little more fresh, that speaks to each of these themes. The title of my presentation is Cautious Citizenship, and I want to share with you a working definition of this concept that will help, I think, set the tone and give you a feel for what I mean by the term and why I'm using it and what I hope to do with it as I continue to develop it. I'm calling cautious citizenship a type of civic engagement. And I'm thinking specifically about how individuals, when they're engaging in public life in general, they take into consideration the costs, they take into consideration the benefits, but increasingly are calculating risks that are associated with fully exercising their right to interact in daily life. So it's not just about thinking whether a doctor is worth going to for the purposes of becoming more healthy, but it's also now, as that story from the woman who teleconferenced in to Univision and Telemundo when President Obama was visiting to recruit Latinos to sign up for ACA, it's also about this concern about whether their personal information is going to be abused or be safe and secure. I'm showing you some headlines. These are real headlines that talk specifically or give you an insight into how immigration enforcement is targeting specifically service-providing bureaucracies, public service-providing bureaucracies. So over on the left-hand, upper left-hand side is a Los Angeles Times article that's titled "Immigrant Arrested by ICE After Dropping Daughter Off at School, Sending Shockwaves Through Neighborhoods." So this is not only occurring in California. This has occurred in other locales. And it was basically a pattern in immigration and customs enforcement setting up roadblocks and sting operations outside of public schools, and then detaining parents who were dropping off their children as they were returning back to their cars. A very similar pattern was taking place inside courthouses. Here's one example from New Jersey, where immigrant advocates had identified ICE agents standing outside of courthouses and inside of courthouses as well, waiting as people were coming in to pay for parking tickets. So these were not folks who were detained by sheriffs and already in jail. They were going in some cases, to report crimes. And so they were there to share information that was relevant for an ongoing investigation, and they were detained by ICE agents as they entered or they left. And then this last one over here in the lower right-hand corner is a real tragic story that took place in Texas, where a young woman was being transported from a smaller hospital in South Texas to one in Houston. And on the way there, the ambulance itself was pulled over by Immigration and Customs Enforcement agents. The ambulance pulled over. The officers then asked if they could verify the citizenship status of the patient that was in the hospital that was on the way to get an emergency surgery completed. And they ended up letting her get to the hospital, but this woman had cerebral palsy and was still detained by immigration officials after the surgery was complete. All of those stories that I've shared with you so far involve Immigration and Customs Enforcement agents, but they're not the only actors that are on the ground enforcing immigration laws. This last story over here that I want to share with you, title is "Immigrant Mother Arrested at Gynecologist's Office Draws National Attention." And the subtitle reads, "Activists Fear Immigrants Won't Seek Care." And this is a really nice example of the deputization that's taken place of local law enforcement officials teaming up with federal authorities to not only enforce immigration laws and help them in their immigration enforcement operations, but also in collaborating with bureaucrats that are on the ground and engaging in providing services as well as collecting information. So this is the story of Blanca Borrego, who visited the gynecologist in Houston, Texas last year, and this was a gynecologist, a specialist that she had visited before numerous times. But unlike her past visits, she showed up with her children and had presented an ID that the intake staff suspected was fake. Turns out it was fake. After she was done with getting her vitals checked in that part of the visit, she anticipated that the next knock on the door was going to be the specialist, and it was going to be the routine visit that she's had before, but instead it was a Harris County Sheriff's deputy. And the sheriff's deputy walked in, explained that she was under arrest for presenting a fraudulent ID. And so this is a felony to present a fraudulent ID. And as she was being escorted out, we learned that it wasn't the case like the other stories that law enforcement officials were just posted up outside of the gynecologist's office. What had happened was the staff working in this gynecologist's office called the police. And so this, it turns out, is a modern day example of a connection, a collaboration between law enforcement officials and bureaucrats who provide services going all the way back to, it turns out, the Depression era. So there's a long, storied history here of information being shared by patients, assuming that it's going to be safe and secure, but in fact being passed on to authorities. The other thing that's notable about this story is that Blanca Borrego was detained, arrested, she was sitting in jail, and the publicity that came as a result of this forced her husband to lose his job. So he lost his job as a result of the exposure that came with this case, and it gives it a really nice illustration of the kind of risk assessment that now you easily imagine immigrants thinking through carefully before they go to get any kind of services, whether that's from doctors and certainly from police, but also, as I'll show later, from educators as well. These set of headlines show us that immigration enforcement, like the story of Blanca Borrego, may be provoking some sort of risk assessment after the fact. So once you go through an experience like this, or you read that this is happening, it's easy to imagine that immigrants might, for example, pass up, even if they are eligible for things like SNAP. This is the Supplemental Nutrition Assistance Program, so that Trump won't deport them. Or fearing deportations, many immigrants are avoiding police and courts, avoiding what was happening, as I showed you earlier, in that New Jersey courthouse. Or fearing Trump's deportation, avoiding doctor visits, as the case with Blanca Borrego. And this other story here in the New Yorker saying that after an immigration raid, a city's students simply vanish. So people are even avoiding attending school. And then this last set of headlines that I want to share with you indicate that immigration enforcement may in fact be affecting folks, their health. So it's getting under the skin. It's showing that there's a connection basically between immigration enforcement and psychological distress. In the case of students from the Greater Los Angeles area, UCLA survey found that students were fearful and depressed, that there was questions being raised about the contemporary immigration crackdowns leaving a psychological toll not just on those who are experiencing them today, but questions now being raised about the intergenerational transfer of psychological trauma, and whether this is creating a public health crisis among the affected populations. And I'm going to share with you some sort of back-in-the-envelope calculations that speak to these kinds of concerns at a very, very service level. So what do we know so far? This is very, very quick summary of what we know, but I want to highlight two things that we know so far about how restrictive immigration policy is spilling over to healthcare and health matters. We know, and there's a growing amount of evidence that says immigration policy chills participation in public programs and the use of resources, whether that's programs like temporary assistance to needy families, I mentioned SNAP, but also participation in Medicaid and the use of Medicaid. We know also that really acute episodes of deportation raids, social workers have been reporting that folks who live in cities where ICE has come in and deported hundreds of people, that there's a real sense that they felt hunted, they feel stressed, and we know from related research that that kind of consistent exposure to stressors can weather the body. It can weather our systems and really break down the body. And I'm calling these critiques, but it's an opportunity, I think, for us to start filling in some additional gaps in our knowledge, one of which is that we know less about the role of local police interior operations that may not be as acute as a big story immigration raid of a chicken plant, for example. It may not be the sting operation that gets set up outside of schools. It might be something that is operating more in the background, like a program of secure communities, which I'll get into in just a moment. And we also have less theory or evidence, at least from the political science side of things, about how the politics of immigration policy effects are being internalized. We have commentary from political scientists that suggests policy does feed back into individuals and they internalize it in different ways, one of which is the psychological internalization where policies signal to people whether they are worthy members of the community. So those kinds of policies, for example, like the GI Bill that tell us you are honored and you are a worthy member of the community. We'll provide you resources, for example, to start your own small business, return to school. You feel valued. That, in contrast to programs that may provide benefits but do so in a paternalistic way, signal that you're not really deserving and we're going to monitor you closely to make sure that you're behaving, can then translate into a different set of behaviors so far as civic engagement is concerned. And then perhaps more obvious are the material effects of public policy. Political scientists like to emphasize that the folks who are the most likely to engage in political participation and actively call their elected officials, turn out to vote, of course, but get on the phone, write letters, join marches, are the folks who have resources that free up their time, right? And that feeds back into later politics and helps explain, for example, why we have a transformation of the elderly and infirmed in the early part of the 1900s to senior citizens. That identity shifted as a result, scholars contend and show compelling evidence, as a result of the Social Security Administration providing resources to the elderly upon retirement so that they could afford to engage in politics. And I think we can add to that, or at least think about ways that we can complement these policy feedback avenues and mechanisms to include an acknowledgement that policy can also have psychological and physical distress as well. So I want to start my argument here by giving you some reasons why I think that immigration politics would be a deterrent, why it would be deleterious, and why it might create some distrust, especially among Latinos. And so I'm going to highlight some things that set us up for that. Immigration enforcement and restrictive immigration policy is super important for Latinos, and it has been for some time. We've got data that indicates that 40% of Latino adults are foreign-born, so they're close to the immigrant experience. 85% of all Latinos have at least one immigrant grandparent, and if we look back at surveys going all the way back to 1994, the public doesn't generally identify immigration as an important issue in general. But when we ask Latinos, immigration is consistently, especially in the last 10 years, ranked as the #1 problem. It's at the top of the mind. It is something that occupies and concerns them when they're thinking about politics, when they're evaluating the political parties, and of course when they're casting votes. From 2007 to 2014, the Pew Hispanic Center said that nearly 1 in 3 Latinos say that that was the most important problem. And since 2010, we have to keep in mind that Latinos have been far and away the majority of targets of immigration enforcement. So 96% of all deportations, according to the track database out of Syracuse in New York, says that these are individuals who are returned to Latin America, right? And then finally, a firm that specializes in interviewing Latinos in the United States, Latino Decisions, through registered voter polls consistently from 2011 to 2016, show that there's a broader network of connections between Latinos and those who are undocumented, as well as folks they know personally who have been deported. So the argument I'm making here is that immigration enforcement and restrictive immigration policy is pervasive, it's personal, and it's chronically salient for Latinos. And the interpretive effects that policy feedback theory identifies can occur through these saliency and social networks, in part because Latinos know to be cautious. They know not to sign up for SNAP or TANF or go to the doctor's appointment if they hear that somebody else has had a bad experience. But also because they're thinking about their own family members' welfare. And so they're learning to be cautious citizens, and that includes avoiding contact with these service-providing bureaucracies. So I want to show you then some evidence that talks about how restrictive immigration policies deter service and program use, it deteriorates trust in bureaucracies, and can be deleterious, again, to well-being here. And just by way of preview, I'm going to walk you through a few different types of evidence, some of which is experimental. I put it together using survey experiments, but some also is connecting actual immigration enforcement intensity on the ground, where people live, and various attitudes and behaviors. And finally, we're going to give you a taste of how this is mapping out to indicators or that are relevant or related to mental health. So with some scholars, some colleagues, Vanessa Cruz-Nichols and Alana LeBron, we conducted a study where we first introduced this idea of cautious citizenship, and we wanted specifically to look at how immigration, just the simple mention of immigration, could tell us something about what was on people's minds. And so we crafted this survey experiment that asked people to tell us how likely they were to make a doctor's appointment or to see a healthcare provider. And we randomly assigned whether they were going to get exposure to a cue that was related to healthcare, one that was related to immigration issues, or just no cue at all. And the healthcare issues, we sort of meant to get at the idea that there's lots of PSA announcements related to health, for example, on the ACA enrollment. And then the immigration issues, we just wanted to get a handle on whether people were responding without any hardcore, like, people are getting deported, families are being separated, like, what is it, without too much prompting, that's on their minds. And so we used this term of immigration issues because we thought that would give us a handle on what was going on in the minds of Latinos before we mentioned anything specifically about those headlines, or anything like that was in those headlines that I shared with you earlier. So thinking ahead to next year, with all the public attention, folks were randomly assigned to one of these three conditions and then answered, how likely are you to make an appointment to see a doctor or nurse or go to a clinic for healthcare services? And what we found was that in our total sample, there was an average deterrence of about 8 points. And to dig in a little bit more about who was being influenced by this message, perhaps more than others, we also broke this down by whether folks were connected personally. They personally knew somebody who was undocumented. And what we found is that appears, just as you might sort of anticipate or intuit, that it's driven by folks who are more closely connected in their social networks to somebody who's undocumented. That simple mention of immigration issues is enough to say, I'm just not interested or less likely to go see a healthcare provider. But we also asked, after that experimental cue was randomly assigned, about whether folks avoided other types of activities. And specifically, we asked, do you avoid these types of activities because you don't want to be bothered or asked about your citizenship status? So here we're being very explicit and upfront about the reason why you would be avoiding it. Is it because of citizenship status concerns or surveillance? And what we found was that 16% of Latino US citizens, so everything I've showed you so far is US citizens, not Latino adults. These are US citizens. Either they're born in the United States or they're naturalized. 16% said they avoid talking with police or reporting crimes. Maybe that's not so surprising. But 14% said they avoid driving a car. Another 14% said they avoid renewing or applying for driver's license, dropping off or picking up someone from the airport. 13% said they avoid visiting a doctor or a clinic. Others avoid public transportation, and then about 1 in 10 say they avoid talking with educators. I'm highlighting these 3 in particular because those 3 have to do with engaging services. Those are the kinds of interactions that are difficult to do anonymously. What I'm showing you here is then the proportion of reticence, or the folks who avoid doing any of these activities who were exposed to this health insurance queue. So for avoiding airports, DMV, car, bus, school, clinic, and bus, and this gray dotted line is sort of the average amount of reticence. But when we look at the folks who were assigned the immigration queue, right, the amount of reticence is much higher, and it's especially separating, and we see the reticence or the deterrence much higher among those kinds of activities that require you to say who you are, right? Like you can't be an adult and go to a public school, for example. That would be creepy if you said, I don't want to tell you who I am. School officials would want to know, why don't you have a child, or who are you here for? And it's certainly difficult to imagine in sort of contemporary politics engaging a police officer without getting asked, let me see some ID. You've got to tell them who you are. And increasingly the case, or at least I should say, that is certainly the case with respect to clinics. And that, of course, is not about surveillance as much as it is about keeping accurate track of records for patients so that you know who a patient is and you're able to diagnose and provide the right treatment over time. So this average avoidance of 5 points that we see from this simple exercise in randomly assigning cues tells us then that immigration politics is inside the mind of Latinos. And we know that it's inside the mind of Latinos, and especially salient for those, again, who are connected to somebody who's especially vulnerable. So among those US citizens who know somebody who's undocumented, so these are individuals who themselves are not, they're not undocumented, but they know someone personally who's undocumented, they're the folks who are most likely to say that they avoid these issues. Take a look at this last panel over here where the difference between those who are assigned the immigration queue and the health insurance queue is 27 and 16, so more than 10 points, so much higher than the average, the 5-point reticence. So we see that those are the folks who are driving those differences. And we also know that it's more than just your social networks, that the layers of policies that we're living through, so not just federal, but also subnational, is driving some of this. So individuals who live in states where we took an objective measure of how much immigrant policy was passed in that state and the extent to which it was welcoming or unwelcoming, those folks who live in states that are perceived or measured as unwelcoming are the folks that are the most likely to avoid these kinds of services. Let's talk really quickly here about the implication of this avoidance. This will be updated, of course, in the next census. But let's suppose that there are 47 million Latino citizens in America. So we're not counting the entire adult population, only those Latinos who are US citizens. If 13% of Latino citizens in the US avoid healthcare providers, as the survey that I just shared with you indicates, and if we took information that you can get from studies that tell us about the average cost of wellness visits for the uninsured, so this is just the uninsured, being $200, and if we compare that then to the average cost of an ER visit, so what does it cost if folks are avoiding preventative care and wellness kind of visits and waiting until things get really, really bad and to go see an ER? Then on the high end, we can estimate that about $6.3 billion is what we're losing in terms of additional costs associated with immigration enforcement that then pushes people to avoid these kinds of critical services at an earlier point. But it's about more than just the behavior of avoiding these services. This is affecting the way that people think about government. In a different study, we looked at the extent to which Latinos might feel pressure to practice cautious citizenship based on the degree to which enforcement varies in their locale. and specifically the extent to which low priority enforcement targets are emphasized in the way that immigration operations are being implemented. I'm going to get to a map in a few more slides that gives you a nice visual of this. But for now, we're thinking about how from one locale to another, those ICE agents and those sheriff deputies may be focused more on folks who are charged with really heinous crimes like murder and drug trafficking and human trafficking, or targeting folks who are trying to pay off a speeding ticket or ran a stop sign. And in this article, we looked at the spillover effect then of immigrant policing on skepticism towards government as a source of information about health. And what we found is that where secure communities immigration enforcement was more intensely targeting these low priority targets, trust in health information from government declines among Latinos. But it turns out that that's only the case for Latinos and not other groups. When we see what kind of attitudes blacks, Asians, and whites have with respect to information from government, there's basically no relationship. And by the way, when we look at other sources of information, so not government, sources like the news media, church, friends and family, we find that there's no relationship for any of these groups between immigration enforcement and their trust in those other sources for information related to health. So it's a nice placebo to indicate that there's something going on here in people's minds. They begin to evaluate the government as a source of information very differently depending on whether the crackdown on immigration is intense or less intense. And I think one thing to take away from that is that when we have the CDC issue public service announcements for seasonal influenza, or let's say there's an outbreak in Zika, this undermines information transmission, right? Because these bugs, they don't care about the race and ethnicity of the individuals that are being touched, right? And it certainly holds the possibility of kicking the cost down the road if folks are ignoring or not trusting information that comes from government as a result of associating them with immigration enforcement. So is immigration enforcement intensity deteriorative of trust? Is there a consequence to the Blanca Borrego stories out there? Are people less likely now to think my information is going to be safe and secure if I hand it over to the staffer doing the intake at my gynecologist's appointment, or am I going to be skeptical? And it turns out that a majority of Latinos say that their information is safe and secure. Only a quarter say that it's shared and that it's not secure. But I'm going to show you what it looks like when we map that to secure communities operations. Secure communities, just for a quick background refresher here, is the core program that does interior immigration enforcement and collaborates or is teamed up with local law enforcement officials. And the way that it works is really simple. Basically, police arrest a person, and that's the first step, and they take them to the local jail to book them. And during that process, they get their fingerprints scanned, and that scanning of information then gets checked and cross-referenced with a larger database that's managed by the federal government. If the federal governments find a match between their database and the folks that are, and the person that's detained by local officials, then another flag gets picked up, and they can then contact the local law enforcement official to ask that they detain the person there for a set amount of time. It's usually no more than 24, 48 hours. And then they can come through, pick them up, take them to another detention center where they may go through immigration proceedings. That entire process is now in operation in every single county in the United States. There are some counties that have resisted elements of this deputization, the 287G program, et cetera, but this is not something that's optional. And it wasn't something that became mandatory, by the way, under the Trump administration. This became mandatory in 2013 under the Obama administration. So it's now in operation everywhere, and what I'm showing you here is a map of how the intensity looks when we just think about the number of deportations per Hispanics. And this was as of December 2014. And the shaded county areas that are darkest indicate that there are more deportations in that locale. Those that are lighter indicate fewer and fewer. And what this tells us, right, is that in most counties in the United States, there's very few deportations per 1,000 Hispanics. That it is concentrated, as you might imagine, where Hispanics live. So definitely in the West, parts of Texas, Florida, and then of course the Eastern Seaboard, where there's larger populations, and in the Midwest, population centers like Chicago. The national average for this particular measure is about 7.2 deportations per 1,000 Hispanics. A county that's sort of representing that figure or comes close to that is Oakland, California. A 25th percentile would be Miami, Florida, where there's 2.9 deportations per 1,000 Hispanics. And then a little bit higher, on the higher end, is Denton, Texas, in the 75th percentile, which has about 10 deportations per 1,000 Hispanics. About 15% of all the folks in this particular sample that I'm looking at here live where there was less than one deportation in 1,000 Hispanics. And then Cook County, Illinois has less than 1%, like those 15% of the sample. And then about half of the respondents, half of Latinos, live in areas where there is 6+ deportations per 1,000. One respondent happened to live in Twiggs County, and that was on the top end of secure communities deportations, and they logged just over 40 deportations per 1,000 Hispanics. By the way, the analysis that I'm showing you here is not sensitive to whether I use the denominator of Hispanics. I can use foreign-born, for example, and the results are very similar. Yes, a question?
Is that deportations per 1,000 per year or over some extended time?
This happened to be as of 2014. So this would be much from 2012 to 2014. So 2 years. So deportations and this question of security of personal information. What this tells me is that the experience that Blanca Borrego had, right, the analog for this, or something that's similar to this, is happening everywhere else. Where county level deportations increase, we get folks being less trusting of what is happening with their information that they share with healthcare providers. So they're more likely to believe that information is not secure if they live in an area where there's higher levels of deportations. Does this translate, or do we find something analogous to this when we ask folks about psychological distress? In this particular data set that I was working with, there was one question that asked whether in the last 12 months folks needed help for emotional or mental health problems, such as feeling sad, anxious, or nervous. And about a quarter of them said yes. So it's not the standard, the gold standard of how do we measure psychological distress or mental health, but it's an indicator that tells us whether that's on their mind, if they're thinking they need this kind of service. And we want to know whether this is associated then with that measure of intensity of deportations. And we find that it is, and just as I had showed you earlier with that experimental evidence, the observational evidence also shows that it's the case that those folks who know somebody personally, who's undocumented, in this case I'm showing you somebody who's been deported, that they're more likely to express this skepticism, or excuse me, the need for mental health in the past year. So the key point that I want to leave you with today is that immigration enforcement, the evidence suggests that it's changing the calculus of engagement for Latinos, and that it's creating this new sort of nudge. It's nudging people to practice this idea of cautious citizenship, and it's doing it through 3 ways. It's deteriorating trust, it's deterring engagement in the use of services, and that it may be getting under their skin. A couple of thoughts that I want to leave you with is that immigration policy is, sure, some of you in the room are familiar with, is now being understood as deeply connected to other policy areas. So when we say that immigration is health policy, we're acknowledging that these vulnerabilities that I've just described to you, they're not coming out of the ether, they're rooted in public policy. And that these policy effects, for much of the analysis that I showed you, right, indicates that it's spilling over to unintended targets, right? These are US citizens. They're not supposed to be the people that get impacted by these kinds of enforcement operations. And the deep irony in all of this, right, is that as President Obama was recruiting Latinos to sign up for health care insurance for the ACA in 2014, in large part he was doing so because he knew bringing Latinos into the fold would help reduce healthcare costs. By simply bringing more people into that risk pool, premiums were going to go down. But as a result of ICE and the immigration enforcement operations deterring people from using these kinds of services, we may be in fact introducing inefficiencies that come directly from law enforcement and introduce new sources of costs then for healthcare provisions. I want to take questions now, but first thank Chaz and Angela Garcia for inviting me, as well as Keith Brown for helping me with all the logistics. Questions? Yes.
Thanks, I really enjoyed that. I have a question about your thinking about local level communities. So one of the thoughts I had, which because of the end you have with your survey data you can't capture, is that you could have a state where it was considered welcoming by immigration policy, but unwelcoming by healthcare policy, meaning they didn't expand Medicaid. Or you could have a state that's welcoming by immigration policy and welcoming by Medicaid expansion. And at least children would be, citizen-born children, at least as of today, would be eligible for those services, and that might work to facilitate trust in some way. So I was wondering if you looked at the intersection between immigration and health, given that that I think is one of your primary interests, and then another question on the second question on the analyses you did for over 2 years, the number per 100,000 who were deported. If there's variation between year 1 and year 2 that's being measured, the model is stronger if you exploit the variation in deportation and get strong. I mean, the more years you have and the more variation, it makes a stronger case for that. So I was wondering if you all were, that would be really exciting to me, so if you all were in the process of looking at kind of multiple years and the variation across those years of deportation.
I'll take the second question first in reverse order then. Yeah, we are in fact looking at it, and the way that we're thinking about it is the change from one year to the next varies, and I think that's what you're getting at. So in the next step, we've got data that we've now collected that bumps up against the end of Obama's administration. So we don't have anything, and I don't know of anybody who's collected systematic data like this under the Trump administration. If you have, then you must have an inside track, and that's great. But I haven't seen any, and so what I'm limited to now is thinking about the change from 2012 to 13, 13 to 14, 14 to 15, and so on. And your intuition is exactly right, that there is a rich variation to be exploited there. Now, the first question that you had, I've been puzzling over that as well, and the way that I entered into it was thinking about how sort of the reverse, right, which was that if you were in a state and lived in a local community that had signaled to the state that they were going to resist the statewide policy, what would that do for you? So I wasn't thinking about it programmatically, but I was thinking about sort of federalism and layers of government, and then specifically contrasting Texas and California. So in Travis County, which is where Austin, Texas is located, there was a very visible law enforcement official who said that we are not okay with SB 54, which was the Texas statewide law that empowered and mandated that all local law enforcement officials had to ask about immigration and citizenship status when they had contact with somebody. So anytime you pulled somebody over, it was no longer an option. You were obligated to do so. If you found out that somebody was not a citizen, you were obligated to report that. By contrast, in California, Orange County and a couple of other counties in the inner part of the state, so the intercoastal area, had declared resistance to what was a statewide policy that prohibited local law enforcement officials from using their police resources to ask about immigration status and citizenship status. So I was thinking about it like that and wondering if there might be some counter countervailing forces that people were exposed to, and if that could help overcome this broader push from the federal government that federal officials or local law enforcement officials might be feeling. So the world's complex, and now I've got to think about how this works for policy as well. Thank you. Angela.
Thank you. That was a really interesting talk. And I wanted to ask you a little bit more about cautious citizenship as a theoretical concept. And if you think there's possibility there that it can extend to vulnerable populations beyond immigrants or beyond people who are undocumented. Because as you were talking, I was thinking a lot about Sarah Brain's work on system avoidance. She's a sociologist at Austin, I think, where she talks about the relationship between people's contact with the criminal justice system and then their subsequent avoidance of institutions like schools, the labor market, financial institutions, medical institutions. And so if it is the case that this could extend out as a theoretical concept, then what are the implications around the actual concept of citizenship as you're using it in this instance? Beyond cost in healthcare and efficiencies, but actual kind of personhood and rights.
Yeah, I do think that it can be expanded out, and in fact, the sort of original inspiration for this for me was some histories about second-class citizenship in the United States in general, including the African-American freedom struggle at different points in time. So this idea of cautious citizenship, the analog for the Black experience, you can think about the Jim Crow era, right? Like people thinking carefully about whether they were going to engage, not just in political participation, but whether they were going to go to parts of the city where it was perhaps the only place that you could see a doctor, but it was very clearly understood, and perhaps signs were posted that said, this is the white-only doctor, right? And so you had to make judgments about how to navigate public space, and I think that's exactly what the Blanca Borregos of the world are doing now. So I am very interested in expanding it as sort of a broader theoretical notion of what is going on when you have second-class citizenship determining then how people think through the way that they're going to engage fully in public life, if at all. And that's just one example, right, as Blacks. And I know that that's changed over time, and it becomes even more sort of salient and relevant as the attack on different layers of citizenship gets deployed. So the latest assault on what is the meaning of legal permanent residency, right? That's being contested. Before, it was always clear that, sure, you could be vulnerable to public charge laws, but in practice, it was just never, it was anachronistic, right? The idea of public charge was, nobody talked about it, but now it's in the public spotlight. And that would be a part of my thinking, is that perhaps the degree to which you're engaging in cautious citizenship varies from one level to another, or is qualitatively different, depending on what kinds of things you are allowed to access legally. But then also, what are the needs that you have? I can imagine an undocumented immigrant who lives with their sibling, and this is not unheard of, who is a US citizen, behaving very differently from an undocumented mother who has children and who knows that her kids are eligible for SNAP or TANF. So thinking through how the household experience and the mixed status is sort of clobbed onto this is another opportunity to sort of think, how can I expand this theoretically? And then in terms of like the implications of personhood, my sort of the positive, like social scientific reaction is this gives us more to exploit. And the normative reaction is the more that we see in terms of policy and policymakers emphasizing or drawing contrast to the different layers of stratified citizenship, if you want to call it that, or tiered membership, the more that they become not solidified, but the more they become accepted, the harder it becomes to undo them as time goes on. Right? So that has implications for personhood, because we now have to square what is our commitment to membership, equality in membership, when we have in practice these clear differences. in operation. Question? Thank you. Thank you.